All right. Can everyone hear me okay? We'll go ahead and get started. We might have a few more people coming in, but we'll go ahead and get started. So my name is Kelsey Sloan. I'm the Outpatient Services Director. I know many faces in here, but there might be a few people I haven't met yet. Basically, I'm here today to tell you about the clinic, tell you about all the services we offer. I'm sorry, I'll try and talk louder. Is that better? Thank you, guys. All right. So the clinic is a primary care office. Residents are welcome to see our providers, Dr. Patel or Ann Gorin, who's our nurse practitioner. I think sometimes there's a little confusion that we function like an urgent care, and unfortunately we do not. We are a primary care. You have to see our doctor or your outside primary care doctor, but insurance doesn't allow us to have two primary cares. So our doctors are from Raleigh Medical Group, but our nurses are all Springmore employees. So residents can always come and see a nurse regardless of who your primary care doctor is. We can do dressing changes, we can check your vital signs, we respond to you if you have an emergency in the community, and we can help triage questions, but we can't do what the provider does, which is diagnose, order labs, or order medications. And if you do see our providers, they have a schedule just like any other primary care office. We do try and fit people in, but we're not always able to do it same day. The clinic is always open. That's something I've been hearing lately. Oh, I didn't know you were open on the weekends. We're open every day of the year, weekends, holidays. There's always one nurse present. So you can always call the clinic and check in, ask questions. We don't have a provider on the weekends. But if you do see our doctors in Springmore and there's an emergency, we get a critical lab back over the weekends, we contact an on-call provider, just like you could do with your own doctor. So resident pendants. I help set residents up with pendants. Sue can also help set residents up with pendants. Sue's our social worker. We previously have just had this pendant on the bottom. It's water resistant, not waterproof. This one functions, it lasts forever. We change the battery. When the battery gets low, maintenance gets notified and they reach out to the residents to help them coordinate with changing the battery. The option for this pendant is to buy a new pendant or a refurbished pendant. We're gonna start offering a new pendant, which is the pendant in the middle and the top. The middle pops out and you can wear it as a watch or a necklace. The good thing about this pendant is it's waterproof. So for anybody that likes swimming, water aerobics, that's a good option. That way, if for some reason there's an emergency in the pool, you can call for help right away. I'm waiting for those pendants to arrive, but they should be here very soon. The difference with those pendants is the battery's not replaceable. So once the device dies, you have to replace it with a new device. The life expectancy of it is 3 years if you use it every day. Most people won't push the button every day, so it should last longer. The other thing that we're gonna do with the pendants is we'll sell this version to residents, which is the white colored pendant. If you use the pool, you'll start to notice each pool, North Village and South Village, is gonna have a black pendant, and that's gonna be for swimmers to use while they're in the pool. It's kind of like having a call bell for the pool. So if you're at the pool, somebody can put it on. As long as somebody using the pool has one, that's a great option for someone to call for help. And then when you're done in the pool, you'll just hang it back up. And Carrie Ritchie is going to partner with us on that to get the location of that and kind of the process of how residents will get it and put it back. Yeah, you can ask me a question.
On that, the white one,
Yes, ma'am.
the new one, is that good in the shower?
So the new pendant is waterproof. I believe it's good up to a submergible depth of like 3 feet for a certain amount of time. I don't remember the exact time, but the company provides us with the exact,
I was just thinking showers are notorious.
showers. Yes, ma'am. So the new pendant would be fine in showers. Yes, ma'am. So we do have a few different services that come to Springmore. These are services that are brought in by outside providers. You can use the service or use your own audiologist, podiatrist. But the ones that we have coming in now are audiology. Dr. Holly, she's been coming to Springmore for a long time. She comes to the clinic the second Monday of every month. She can do hearing aid cleanings, hearing aid checks, and she can also do hearing tests. So you can call their office to schedule. We also have a dermatology company come. Right now, the dermatologist is a physician's assistant. Her name is Julia. She's been coming to Springmore for, I think, about 6 months to a year now. They can do skin assessments. She can treat rashes. They can also do biopsies here. If you needed a more complicated procedure, they would refer you to a different office. They do their own scheduling as well, and they're here once a month. Dr. Lisk is our dentist. He's also been coming to Springmore for a very long time. His office is about a mile up the road from Springmore. He sees residents at Springmore once a month, usually on Fridays. He does prioritize residents who physically can't get to his office to be seen at Springmore. Anybody can go to his office and be seen, but I think last time I checked for a new resident to be seen here at Springmore, he's scheduling about 6 months out. We do have optometry services through Health Drive. She can do vision screenings, update glasses prescriptions. She's not an ophthalmologist, so if you have a more complicated eye need, it's better to stick with your current ophthalmologist, but she can update prescriptions. She's here about 3 to 4 times a year. We have 2 options for podiatry services. One option is through Health Drive. They come to the clinic once a month, and you call and schedule appointments with them. Or actually, the clinic, you fill out a paperwork form consenting to treatment, and then the clinic schedules the appointment for the next time they're here. They bill insurance like normal. The other option is Dr. Hill. She comes to Springmore about once a month. The difference is she does not file insurance. She comes directly to your apartment. She does her own scheduling. She has worked independently. She runs her own company for a long time and has excellent reviews. She says podiatry services aren't normally covered by insurance anyways, so she doesn't file with insurance. And then we also have Trinity Therapy. Your physician can prescribe orders for therapy, physical therapy, occupational therapy, or speech therapy. I think sometimes it's a little confusing what the different therapists can do. Occupational therapy works on fine motor movements. They also help with activities of daily living, like how's my most effective way to shower? How can I brush my teeth or tie my shoes? They also work a little bit on cognition and memory. Physical therapy really works on big motor movements, strength, mobility, balance. They can also do vestibular treatments for people that have problems with vertigo. And speech therapy. Speech can work on speaking, swallowing. They also kind of cross over into cognition. So a lot of times if people are having difficulty remembering to take medicine, they can work on strategies for that as well. So our pharmacy that we have that gives medicines to our skilled residents in Stewart Health is Neal Pharmacy. They also have an on-site pharmacy now, Haley. Haley's going to do a talk at some point in this series, so you'll hear from her directly. But part of what the clinic handles for the pharmacy is 7-day pill packs. So this is when the pharmacy will package your weekly medications into a pill pack. This is what it looks like, and I'm sorry my camera couldn't capture it very well. But this is an example with some Skittles. I only had one pack left because the nurses get hungry sometimes. But they package the packs weekly. So for this example, somebody took medications 3 times a day. So the days of the week go vertically, and then the times of the day go horizontally across. So Neal would take your prescriptions and package it exactly at what time you're supposed to take what based off of what your doctor tells them and your personal preferences of when you like to take medicines. They deliver it to us in the clinic on Friday. We check over to make sure we have everybody's medicine, and then the clinic delivers it to your apartment Sunday morning. There's no cost for this packaging service. The only cost is using Neal Pharmacy. And Neal bills just like any other pharmacy. Their prices are competitive with Walgreens, CVS. The only price difference we see sometimes is when people use mail order pharmacies because they price very low and it's difficult for actual stores to compete with their prices. But there's no additional cost for the packaging of the pills. One of our newer programs that Charlotte started before she left is our incontinence program. We partner with McKesson, who does our supplies for the health center and the clinic. And the company that they use for incontinence programs is Prevail. So we have all different levels of incontinence products for whatever level of incontinence someone might be experiencing. I included our ordering sheet over here, so that breaks down the different products and also the pricing per pack, and it also gives you the pricing per item. So you can see, oh, this pad cost 20 cents per individual pad. So that way you can really compare it to what you're doing currently. Kayla, our secretary in the clinic, has really taken over this program. She's great at getting people set up on it. And then you can pick how often you want these products. So I could say I want 1 pack of pads delivered to my apartment every other week. And every other Friday night, security delivers the products to your apartment. You'll wake up Saturday morning and they're there. All right, and that's it for me. And now Maya. Yeah. Yes, ma'am.
We can expect from the clinic if we're not, I have an outside physician. COVID is very much on my mind and everybody else's these days. And with the government not supplying free COVID test kits, and I remember back when COVID was prevalent, that the clinic was not doing any COVID, didn't have any kits. They would send somebody who was not serviced by the physician here down to a doc in a box to get a COVID test or confirmation that they had COVID. Will the clinic or in coordination with the pharmacy be having any kind of COVID kits, so at least we would have, rather than drag out and just, stick it up the nose, which all of us have been doing. It would be so helpful to have those kits for everybody, not free. I mean, it could be charged to to be able to step in and say, I want a COVID kit, charge it to my room, would be so helpful.
Yes, ma'am. That's a great point. We do have that, and I'm glad you brought it up. We have flu test, COVID test, And now we have one test that has flu and COVID. We also have an RSV test. So I have the pricings in the clinic. I believe the flu and COVID test is about $15. The flu test is about $10. The COVID test is about $10. I want to say the RSV one's a little bit more expensive. I think maybe around $20. Don't quote me. I can give you the exact prices in the clinic. But we do have that now. Any resident can come and get tested. We charge it just like we may charge for a dressing supply. It gets billed to your Springmore account. The caveat is if you test positive and you're looking for a medication, you would have to reach out to your primary care.
Terrific.
Perfect.
So much better than racing down if you're not feeling well.
I understand.
Get a diagnosis.
Yeah. We do at the clinic, because we do only staff 2 nurses at a time and 1 nurse on weekends and holidays. We don't come out to do COVID testing or flu testing. Nurses only come out to residents' apartments for emergency situations. Basically, if we're coming out, we're triaging, something's wrong enough to the level that we need to be looking at skilled nursing, or are we looking at the hospital? You know, for some reason you're not able to get to the clinic. A lot of times we offer for security to come get you in a wheelchair and bring you to the clinic, or you can always come to the clinic and see us. But, you know, call us with any problem or concern and we'll walk through each case individually over the phone. Yeah.
Did you say that if you do test positive, you have to get an antibiotic or whatever it is from your own doctor other than here?
Say that one more time, Miss Bird.
If you test positive, you want to get the medicine as fast as possible. My sister just had it. You not get that medicine here, or do you have to go to get your own doctor to call it in to hear what?
So if you see Springmore doctors, then you can get the medication from Springmore doctors because they're your primary care doctor. Only for residents that don't see Springmore doctors, they still have to go see their own doctor. So
you have the medication right here on hand.
we don't have it, but the pharmacy has it.
Okay.
So you can get it from Haley. I know Haley is open half days sometimes. So if you were like, I want it right now, we probably would talk about sending it to another pharmacy. Neal Pharmacy does deliver to us to the health center twice a day. So I can always get you a medicine by the next morning, even if for some reason Haley wasn't open. But if you're like, I want it right now and Haley's closed, we would have to send it to another pharmacy. Any other questions for me? And we'll do questions at the end as well if you think of anything else while Maya's chatting.
When signing up for Medicare Part D, is Neal Pharmacy considered a preferred pharmacy?
That is a good question. I don't know. She said when signing up, like if you have Medicare Part D, is Neal Pharmacy a preferred pharmacy? Okay, we have an answer from Brad, and he says 99% sure yes. Haley she'll be able to know for sure as well. I try and stay out of the insurance world a little. Yeah. All right, I'm gonna pass things over to Maya, but we'll do questions again at the end.
Hello, everyone. Can you hear me? Hello, can you hear me now? Should I hold it? Okay. Okay, I'm a light speaker, so I'm going to try to talk loud so you can hear me, okay? I am the nurse manager. My name is Maya. I work in supportive living, and I'm not going to take up too much of your time, so we're just going to jump right into it, okay? These are just some of the points that we're going to hit in the presentation as far as what supportive living offers. So does anybody know where supportive living is located? Do we know? It's so hard to find. Yep. Supportive living is an extension of independent living. It is located at the far end of West Apartments. We have units located on both the first and second floor. So our supportive living entrance would be entrance 5. All right. One good benefit to supportive living is that we have medical staff that supports residents 24 hours a day. You will have a nurse. So I am there Monday through Friday, 7 to 3. And then you will have a nurse assistant, second shift from 3 to 11. And then you will have another nurse assistant on third shift, 11 to 7 a.m. So our staff provides intermittent prompting and encouragement with ADLs. So we're not there to go in your apartments and be all in your business all the time. But we're just there to give you encouragement, okay? We work closely with the clinic. So I work closely with Kelsey during the week. We help with coordinating and monitoring the necessary care for residents. So our staff would be your first point of contact in supportive living. So say like if you had a fall, you got a skin tear, instead of going directly to the clinic, you will come to our nursing staff first. If there is something that is more of dire need, then I will contact the clinic and then we'll go from there. How many? About 30. Yep, 32. 32. All right. We also assist with coordinating appointments and transportation needs. So we work with you all to coordinate your in-house appointments with the clinic if you need assistance, and if you need transportation for outside appointments. Again, I will be your first point of contact to I work directly with security to get your transportation needs met if you need assistance with that. Okay, we do have a staff-supported medication program. So as Kelsey previously stated, we encourage our residents to have the 7-day medication pack that Neal Medical provides. It's not mandatory, but to be on this program, we do encourage that. So with this program, we offer verbal reminders throughout the day. This is just passing reminders. So if I see you in the hallway or coming from meals, I'll say, "Hey, Mrs. Jones, did you take your medicine today? Make sure you take your medicine after breakfast or after lunch." Just a passing reminder. We will review your 7-day med packs. So we are required to enter your apartment 3 days a week just to assess your med pack to see if you're complying with your medication. Okay. A good thing about supportive living is that we offer a smaller environment. So it's more of a quaint neighborhood setting, and it's designed to be more intimate to help prioritize residents and their needs. So everything is in close proximity to your apartment. So we have common areas such as a day room, an entertainment parlor. Within that parlor, you will have your mail area. And then we also have 2 open porches. We do have our own activity room and our own dining area. And we do have our own dining services in supportive living. So, of course, they provide 3 meals a day. Our hours may vary from what you're probably used to in the central dining or, in the main dining area. So breakfast is a little early from 7:45 to 8:45. Lunch is from 11:45 to 12:45. And dinner is from 4:45 to 5:45. Residents are encouraged to eat at least 2 meals in the supportive living dining room, but you do not have to. It's encouraged just so you can get a feel of the area and also the residents who do live in supportive living. All dining options are still available to supportive living. You are not limited to supportive living dining options. You're not limited to supportive living at all. It's just an extra piece of the puzzle that you can have as far as community. We also have our own pathways in supportive living. So we have our own activity coordinator that creates programming specifically for supportive living residents. And they do take place in our activity room down there, but she also uses a lot of the common areas. And she also creates supportive living field trips as well. Again, our residents are encouraged to participate in supportive living activities, but again, they're not limited to supportive living. So everything that's still, you guys have like an activity portal, correct? Our supportive living residents can still access activities outside of supportive living. And that's pretty much it. Any questions?
Do you have to sign in and out?
If you go off campus, yes, ma'am. Off campus, we do have a sign in and out sheet located at the staff office, which is also right at entrance 5.
You're never kept in supportive. It's more for our benefit that if we're like, oh, hey, Miss Bird's not at dinner and we're worried about you, because that's what supporting offers, is that prompting, guidance. We call it observational nursing. So if we're worried about you, then we can go look in our book and say, oh, she just went out to wherever. So it just is more of a extra check for staff.
Yes, I guess the biggest takeaway from supportive living presentation is I want you all to understand that you're not losing anything or you're not limited, again, to supportive living if any residents so choose to move there. You're just gaining extra assistance. You're gaining, I like to say, extra family members, but everything is still available to you, okay? Yes, ma'am.
What type of living facilities do you have when you're in supportive living?
As far as units,
Yeah, like a apartment or whatever.
it is an apartment. It's an apartment. It is a smaller apartment, so it would be considered an efficiency. So it would more so, you won't have like a wall that separates your living from your dining from your bedroom. It's pretty much like an open concept.
Does it have a kitchen?
Yes, ma'am.
Okay.
Has a kitchen. It's just a little smaller, little closer quarters.
Okay,
Yes,
thank
ma'am.
you.
You're welcome. Yes, ma'am.
So that's a good question. So we've been kind of reevaluating that recently. So yes, you can cook in the kitchens. The caveat is if for some reason staff thought it wasn't safe, which that applies to all independent living, Springmore has the right to say there's a safety concern or there was a safety event and we may disconnect the stove. But that's everywhere. I think the goal of supportive is with the smaller units and with 3 meals a day is to provide that community and also to kind of decrease some of the stressors, take away some of the things that are on your plate so you're able to just enjoy the community time or the activities. So that's kind of the goal at that point. You know, we're starting to think about downsizing a little bit and having those extra things in place to give you the support that you may need or want.
Yes, ma'am.
Is there laundry service? Just wondering.
So the services that we provide, say if you want laundry service, we would then start thinking more so of maybe home care. and they will do laundry. We do have laundry rooms located in supportive living.
So your residents do use.
Yes, ma'am. On the first floor and second. No. First floor and second floor, we do have laundry rooms. Yes, ma'am.
Would there be any opportunity for Springmore to provide like a tour type thing?
Yes.
To go through supportive living, just to kind of see with our own eyes?
Yes, ma'am. We can absolutely set that up. I would love to do that actually for you and be involved with that because I want you to come be with me when the time is right. Any more questions? Yes, ma'am.
Do people do takeout in supportive living?
Yes, ma'am. As far as your meals, yes, ma'am, we do. You can order from our dining room specifically because it's just closer to you. So typically, of course, if you're sick, we can do meal trays as well. Yeah, we could do that. Yes, ma'am. So you can get it quicker from our dining room. You can come, yep, you can come down and pick it up. Any more questions? Yes.
Who decides when we're ready to go to supportive living?
You do. You do, and then your point of care. So you chit chat with your family members. Yeah, and if you can't tell, this is my right hand or my left hand. Yeah, this is my right hand. So any questions that I don't know or she can better answer, then she takes the lead, okay? So I'm going to pass it to her.
Hi. I think since I've come in to this role, I think what we're trying to do is shift the perception of supportive. Because I think previously the perception was these residents need a lot more care and, I'm not forgetting things or I'm not, needing help with whatever. So I don't need to live there yet. But that's not really what supportive is for, what supportive can offer, because anybody can live in supportive, because you do have to be independent. It's independent living still. But if you feel like that additional support, that smaller community, having staff around, 3 meals, if you feel like that would benefit you or that's something that you would like, anybody can move into supportive living. The limit is you still have to be able to function independently. You still have to put home care in place if you need certain things. But a lot of our residents that are there now just like the smaller community because Springmore is a big place. So they have their kind of support systems down there. You eat meals with the same people. They play games. They have their own bridge group. And I saw Sue down there playing one day with the residents. So it offers that smaller community. So there's no limit of who can move into supportive. Does that answer a little? Okay.
I, too, participate in the activities. I like to have fun. We have 32.
Too quick.
32. Any more questions? All right, I guess it's safe to close it out. Thank you all for joining us today, and I hope to see you all soon. If you guys want a tour, we're going to set that up pretty soon, okay? Thank you.
Yeah, Maya's name's in the name and numbers in the big address book. My number, the clinic's number, or Sue. You can reach out to any of us with questions about the clinic, me or Sue, or about different areas of living or different resources. And then you can reach out to any of us or Maya for questions about supportive living or tours. Okay? Yeah.
Can you answer one question about supportive living that I get frequently?
Yeah.
Bathing and how is that handled in supportive living? Can you assist with showers? Can you not? What are the limitations there?
Yeah, so supportive living does not provide hands-on care. So if you, just like in independent living, if you wanted someone just in your apartment for safety with showering, if you wanted help or assistance with bathing or showering, we could assist you to connect with home care, and you would bring in home care to help with those services as well. But supportive living staff is there, always nearby, if you if you do need help. If you need staff to step in, they're not going to say, no, I can't do that. But if we see it's happening again and again, that's when we would connect you with home care, because it looks like you might benefit from that service. Yes, ma'am.
I want to ask about meals. There's 3 a day apparently. Are they priced all the same, or how does that work?
So with supportive living, the meals, activity, nursing care, that's all included in the cost of supportive living. That's the price difference that you'll see between regular independent living and supportive living. It's those additional services. We have a question. Yes. Okay.
Does long-term care coverage, is that part of, can you use it for supportive living?
That is a good question as well. And I think that Charlotte has tried to work with some residents who were moving to supportive with long-term care in the past. And I don't know. I don't think it always kicks in. That would be something we could connect you to Amanda, and she could work on that with you, because she helps all of our residents with their long-term care policies. Is that your understanding, Sue?
Yeah, I think Amanda would be the best. I think from people who've tried to use it, because it's still considered independent living, it's not assisted living. It's not in a licensed, assisted living is actually requires a different licensing. So that becomes where they get really sticky. Yeah.
But my understanding is that you could still use that if you wanted to bring in home care. So if
Yes.
if that's something you wanted to add on, that's when that would come in.
I will say, is it okay if I?
Yeah.
Because I work closely with both Maya and Kelsey. And when we see folks in independent living who used to be active and now are not coming out and going to meals, they're more socially isolating themselves. Maybe they just have some, it might be anxiety. It's sort of like you move here from home and the place almost feels smaller. And then as your health issues grow or change, the building all of a sudden seems bigger and bigger and the hallways longer and longer. And so your temptation is to stop going to activities or stop going to meals. Well, when you do that, your brain will be impacted, right? So our social connection is kind of maintained and encouraged by going to meals, going to these activities, just talking with people at the mailbox. So when you start withdrawing from that, we get alerted. Sometimes it's residents say, hey, I'm concerned about someone, or the dining staff will say, I really haven't seen so-and-so. And so not that we want to push, but we want to offer supportive as an option. Sometimes we'll call family. Sometimes we'll talk to, hopefully, ideally we talk to the resident first, find out what's going on. Sometimes that person just has some changes in cognition and they're more self-conscious, feeling I can't keep up with what I used to do. Supportive is great. It's a great forgiving little community. Within the bigger community, you're still independent. But also the nice thing is you can walk to the dining room and you don't have that stress of who do I sit with, and because it's just you sit down, you have Sharon and our other dining staff are wonderful. They get to know you. And so there's just this extra layer of support and family, because the staff really know you. And there's some residents there who were in South Village or other parts of North Village and now are like, they're coming to activities. They're saying, I didn't know this would make such a big difference. So that's where we really try and advocate for supportive, because we want folks to thrive And even if it's another year, 2 years, we want you to be enjoying yourself and thriving and having that social connection. And I like to see what can we do to not have you go to the health center. And if we can be proactive, let's do that.
I have to say, my grandson and I volunteered in the supportive living a couple of times with the activities, and it was so much fun. The people were all, it is like a family, like you said, and the activities they were really good activities. We enjoyed it.
Yeah, Becky does a great job with activities, I think.
I know you commented that bathing, you would have to get assistance coming in. I've been curious, and I can understand, and I know it's a fine line, if there is a fall. I've seen this happen in independent living, or, where a fall, obviously, you want to be sure there's no concussion or any broken bones or any of that. But I've seen people and heard of people stuck in a chair, and for some reason, at that point, and the guards absolutely, and I can absolutely understand that, cannot touch them. There's too much liability there. But these crash carts come in. My incident was someone was in my home and just couldn't leverage herself off the commode. Crash, we had to wait a while. I couldn't get her off, and I didn't want to wreck myself trying to get her off. And the crash cart came, and they said, what's the emergency? Nothing. All we need is somebody putting their arms under here and just standing her up. She walked right on off. And obviously that needed to be reported. But in supportive living, you're going to, can you put hands on like that?
Yeah.
Okay.
Yes.
So
supportive living, if you need help standing up, yes, they'll help with that, of course. I think sometimes just on community calls in general, the guards aren't sure medically what might be going on because they don't have access to those records. Correct. That's correct. So, and sometimes as a nurse, when we get a call, they'll say code green or community call. So we don't know what we're walking into. Sometimes we hear it's a fall and it's something crazy going on, So we always come prepared the exact same way. And I'd rather be over prepared than under. But yes, in supportive living, they'll help with things like that. Yeah.
We do, in those instances, we do encourage pendants. Say, like, if it's not in the dining room, if it's in your apartment, if you push that pendant, I can get to you really fast. Security will call me, and I'm right there. If I do need assistance to helping someone up, that is when I do call the clinical nurse. So you'll have extra staff. Any more questions? All right. Thank you all for coming today. Have a good one.